Arthritis. Why we should ban this word when it comes to most joint pain. Hi, this is Dr. Zachary Ward, and I'm an upper cervical chiropractor practicing in Auburn Hills, Michigan. You can find me online at liachiro.com. You can also find my podcast at survival-value.com. I am a co-host with my colleague, Dr. Anthony Rumsey of the Survival Value Healthcast. So let's get back to arthritis. Why we should ban this word when it comes to most joint pain. Have you been told that you have arthritis? What about arthritis in your spine? Have you fooled yourself into believing you are doomed to a life of pain? If you've gotten an arthritis diagnosis, you're going to hear 3 facts in just a minute that may give you hope that things aren't as bad as you might think. The first step in dealing with arthritis is taking your power back over the very word arthritis itself. Why you and I should ban the word arthritis from our vocabulary. 3 reasons. Number 1, it's overused by doctors to explain any pain they can't explain. 2, it creates unnecessary fear and loss of hope in people who really do have options for overcoming their joint pain, even chronic joint pain, naturally. And finally, arthritis as an explanation for most or all spinal pain isn't backed by science, which you're going to see here in a minute. So let's go ahead and dig in, get to the bottom of this, starting with fact number 1. Fact number 1 is that arthritis means joint inflammation. By definition, it's a description. It's not really a real diagnosis. As another example, the word cephalgia is a medical term for head pain. Again, another description, not really a diagnosis. So saying you've been diagnosed with arthritis is about the same thing as saying you've been diagnosed with joint pain. Probably knew that about yourself already. Or maybe someone with head pain saying, I've been diagnosed with a headache. So imagine a patient walks into a doctor's office and the patient says, my head hurts. The doctor says, oh, you've acquired cephalgia. The patient knows what's going on and says, great, you've told me my symptoms in Latin. Thanks. The doctor says, you're welcome. That'll be $179. But some of you may be thinking, but I thought arthritis was a disease. If you're thinking about rheumatoid arthritis, RA, or another disease of the immune system where the body attacks itself, you are right. RA or rheumatoid is a real disease based on real diagnosis, based on real tests. And so are a few other inflammatory arthritic diseases, which is what RA is, like psoriatic arthritis. This isn't the kind of arthritis we're talking about, the kind where you go to your rheumatologist. We're talking about arthritis like osteoarthritis, or joint pain from joint inflammation that has no real explanation. In this case, this kind of arthritis is really a quote-unquote throwaway diagnosis. So why are the joints inflamed? Now that is the question. Chronic joint inflammation, from my perspective, is probably happening for a couple of reasons. Number 1, poor nutrition leading to body-wide inflammation. There's inflammation everywhere. There's inflammation in the joints. There's inflammation in the heart, etc. So there's joint pain. Chronic inflammation in the joints can also come from trauma. For example, you had a whiplash injury 6 months ago. You've tore, stressed, damaged some ligaments in your neck. You may have joint inflammation from that trauma. You can also have poor body and spine mechanics, including not moving enough, sitting down all day, causing the body and spine to break down sooner over time, and certainly being overweight can contribute to this. At my office, we talk about the body being in lockdown or a quote-unquote stress position. This stress is one key source and cause of the symptom arthritis. This stress causes a breakdown over time that doctors identify as quote-unquote osteoarthritis on an x-ray. Arthritis is really just a symptom of another problem. Fact number 2, you can see the results of joint inflammation or arthritis on an x-ray. But here's the deal, you can't really see the pain. So many people get a diagnosis of arthritis after they've had an x-ray of their spine. So there's no doubt that you can see the results of long-term joint inflammation on an x-ray. I see it all the time. These results look like calcium deposits where they shouldn't be. So if you think of those mineral deposits inside of an old pipe, that's kind of what that looks like. You can also have joints where joint spaces have shrunk and gotten smaller. Everything looks compacted and squashed. The shape of the joint may have changed. These are all signs you have had arthritis in your spine or other joints. A doctor may look at these changes and say, well, you've got arthritis. And all this means is that you've had some body inflammation, trauma, or some poor body mechanics changing the shape of the joint over time, causing inflammation and breakdown. But from the perspective of the X-ray, that inflammation was in the past. It may still be happening right now, or it might not be. That X-ray won't tell you. Inflammation is a chemical process that happens at the micro level in the body, in the tissues. You can't actually see the inflammation happening in real time. Not on an X-ray anyway, unless you've got some sort of microscope implanted into your body. So an X-ray captures what has happened in the past, just like a telescope looking at stars may see starlight traveling at us from the past, not the present. Arthritis on an X-ray may explain pain you had in the past, but not necessarily the pain you have now. Which brings us to point number 3. Fact number 3. Arthritis on an X-ray happens in people who don't have pain, and it seems to be happening all the time. So here's the short version of a long story. Give 1,000 people an X-ray or an MRI, and many of them will have all kinds of ugly changes in their spine. But many of them will have no pain, absolutely none, and they'll have zero knowledge that their spine looks as bad as it does on an X-ray. So here are a few more details to help that fact sink in. A recent study was done on arthritis on X-ray and MRI, and this is what they found out. In a group of 20-year-olds with zero spine pain, a full 37% will have evidence of disc degeneration in their spinal column. In a group of 80-year-olds on the other end of the age spectrum with zero spine pain, a full 96% will have disc degeneration. So they showed signs of arthritis on an X-ray, but they weren't in pain. So disc degeneration, you could say, well, maybe that's not that bad. So let's go ahead and look at another sign that is supposed to be incredibly painful for many people. That is the sign of the disc protruding near the spinal cord. In a group of 20-year-olds with zero spine pain, a full 29% will have a protruding spinal disc. In a group of 80-year-olds with zero spine pain, a full 43% will have a protruding disc. Again, these are people with serious stuff happening on their X-ray or their MRI, but they have no pain. So if you're afraid you're going to be in pain forever because you have arthritis on an X-ray, remember this research. If arthritis on an X-ray caused pain all the time that it was there, then 96% of the elderly would be in constant pain. I have worked with plenty of patients who have quote-unquote arthritis pain with a lot of damage on their X-rays. Many see great improvements in their pain, sometimes in a very short time. We may even take another X-ray of that neck, for example, several weeks to several months later, and guess what? In that neck, there's still signs of arthritis, but the pain is gone. In other words, their pain wasn't permanent because they had arthritis on an X-ray. No, their pain was present, probably for the same reason that they had arthritis on the X-ray, but the arthritis was not the diagnosis that was causing their pain. In many people, it's going to be the body-wide inflammation or that body lockdown. This is Dr. Zachary Ward with Life in Alignment Chiropractic. Again, you can find me online at liachiro.com.